Ever found yourself pondering the profound difference between clinical depression and a mere bad mood? It's a question that often stirs the mind, especially on those gloomy days when the world seems a little less bright. Imagine a bad mood as a passing storm, dark clouds obscuring the sun momentarily before drifting away. On the other hand, clinical depression resembles an endless winter where the sun seldom shines and the cold gnaws at your very bones. It's a stark contrast, isn't it? A bad mood, although unpleasant, is a temporary state. It's like an unwelcome guest who arrives unannounced, causes a bit of a ruckus, then departs, leaving you to return to your normal state of being. It's ephemeral, often triggered by external factors such as a stressful day at work, an argument with a loved one, or even just spilling your morning coffee. Clinical depression, however, is a much deeper and pervasive issue. It's not merely a storm that passes, but an enduring climate, a relentless chill that permeates every aspect of your life. It's a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It's not just about feeling down, it's about being trapped in that darkness for weeks, months, or even years. Unlike a bad mood, which can be linked to a specific event or circumstance, clinical depression often has no apparent cause. It's a complex interplay of genetic, biological, environmental, and psychological factors. It's not something you can simply snap out of or overcome with a bit of positive thinking. It's a serious condition that requires professional help. Now let's consider the physical manifestations. A bad mood might make you feel lethargic or irritable, but with clinical depression, the physical effects are more profound. It can lead to significant weight loss or gain, insomnia or hypersomnia, and even unexplained aches and pains. To summarize, while both a bad mood and clinical depression can darken your days, they are vastly different. A bad mood is a temporary cloud on your horizon, while clinical depression is an unrelenting storm. A bad mood can be linked to specific events and dissipates over time, while clinical depression is a complex condition that persists and often requires professional intervention. So, the next time you find yourself or someone else confusing a bad mood with clinical depression, remember this comparison. Understand the difference, for knowledge is the first step towards empathy and support. And remember, it's okay not to be okay. Seek help if you need it, and always be kind to yourself and others.